Hi, this is Dr. Brandon Erickson. I wanted to talk to you briefly today about biceps repair surgery, specifically the distal biceps repair, and what you can expect after surgery. Now, the biceps tendon actually starts inside your shoulder and outside your shoulder, runs down your arm, and then turns into a tendon as it inserts in the bone of your forearm. And sometimes, either because something was falling and you went to grab it, or you went to lift something too heavy, the biceps tendon can tear. And generally, when that tears completely, we recommend fixing that so that you can maintain your strength in the arm and not suffer from cramping in the arm and things like that. Now, to fix the biceps, it's an outpatient procedure. It takes about 45 minutes to do it, so you come and go home the same day. And what we do is we make an incision in your arm, we find the torn biceps tendon, and we fix that back down to the bone using a small little unicortical button. Now, the surgery itself, as I mentioned, takes about 45 minutes, and we give you a nerve block to help with your pain. When you wake up from surgery, you're actually in a splint in your arm, so I don't have you moving the elbow for the first week. When I see you back in the office in a week, we get rid of the splint, and then I put you into a hinged elbow brace to set specific motion parameters on your elbow. And I have you start therapy at that point. And what they'll do is they'll work on taking you through specific range of motion that we can set. We let you bend the elbow passively afterwards because that doesn't put any stress on the biceps. We don't have you extend it too far right away because we don't want to stress that repair. We also don't have you actively bend the elbow or put too much tension on the repair because you are stronger than that repair for the first several weeks. And so what we want to do is protect that from any type of damage that might happen. So that's why we put these parameters in place. Now, again, after surgery, I mentioned you'll be in the splint and you'll go home with a set of pain medicines. You'll have a anti-inflammatory medicine, some Tylenol, and some pain medicine. I want you to take the anti-inflammatory medicine and the Tylenol pretty much scheduled for the first few days. And then you only take the pain medicine if you need to. If you don't need it, don't take it. You don't need to bother with it. The other thing that'll help with your pain is to put a big bag of ice on the arm or an ice machine that you may have purchased. Yes, I know there's a splint on. Yes, I know it's thick, but still putting that ice machine or that ice bag on will help with some of the swelling. Now, the other things you can do is you can still move your hand, open and close your fingers like this to help get some of the swelling out of your arm because I don't want the arm to get too swollen. When I see you back in the office and we get you into the hinged elbow brace, I'll let you do more things. But most of the things we do the first few weeks out from surgery are really just to protect that repair. I hope this helps answer some of the common questions we get after this surgery. Have a great day.